Hey guys, it's Adam White with Custom Fitness Consulting. We're here today to demonstrate a few different exercises, especially when it comes to an injury. So if you have an injury and you're looking for an alternative exercise that will allow that injury to heal or allow you to stay away from something that is injured, give you a couple different option and variations to be able to use. I have Dr. Kirk Iodice here with Advanced Chiropractic and Rehab. He's going to introduce himself a little bit more, and then we'll get in here and start showing you guys some exercises.
Hi guys, Kirk Iodice here. Thank you, Adam, for having me here, and thank you guys for watching out there. So the reason I'm here is that my style of practice is what's commonly referred to as sports chiropractic. So in addition to the spine-related conditions that a lot of chiropractors will assess for and treat, what that usually means is that we incorporate soft tissue treatments, which means we loosen up tight spots and help to break up scar tissue knots and things like that. We also typically will incorporate rehab, and then we also will know helpful advice for helping to make our lifts and our workouts a little bit more productive. So the objective today, as Adam said, is that we want to go over some lifts for if you currently have pain. I'm sure we can do additional videos in the future, and if there's a need out there, we can do those videos too for what lifts to avoid, period. But let's just say if you're already hurt and you're lifting, what are some alternatives we can do? And today's topic is specific for back pain, and in particular low back pain. So we're going to go over variations of the squat, the leg press, and the deadlift. The disclaimer first though is that if you have back pain, if you're having chronic pain while you're working out, you should seek the help of a professional. And I have a recommendation for you on how to find one later on. Also, if you cannot stand up straight, if you can't walk across the room, if you can't go up and down the steps, if you can't sit on the toilet without excruciating pain, you should not be working out. Again, please seek the help of a professional. But without further ado, we'll go ahead and get started here and talk about some squat form. Okay guys, so the number one exercise that people have a tough time with after they have a back injury are back squats, and we'll explain why that is in just a second. And I can tell you from my personal experience that I actually have to do these variations that I'm going to show you because I can't tolerate back squats anymore. When I was younger, squats was kind of like my thing when it came to lifts. If I may not have been the biggest guy in the gym, but usually I could squat more than anybody else. So for me, it was kind of painful to come to that realization, but I still can do lifts that develop my legs and keep my legs strong. So let's first explain, and first of all too, back squats aren't a bad exercise. They are actually beneficial and good for you. But when you've had a back injury, particularly a disc injury in your back, no matter what you do and how careful you are and how tight the belt is, they still can be tweaky for you. Okay, and I know this from personal experience. I also know this from professional experience. So let's talk about a little bit why the back squat can be so tweaky. So I'm going to have the man here demonstrate for us what a proper back squat looks like. Okay, so go ahead. Pause if you don't mind. So one thing I want you to notice is that here's the bar. So this is where the weight is, obviously. And here's where your low back is. Okay? There's a distance between here and here. In other words, it comes out about, say, 18 inches or so from here to here. You can back up. So what does that mean? That is a lever arm, okay? So the way to think of it is this. If I want to use a crowbar to lift up something, I'm not going to take a short crowbar and try to pry up like this. The longer the crowbar, the more force is exerted at the end of it. The same principle is true here. So go ahead and go down again. This is no longer 100, 200, 300 pounds. Its weight is magnified now at the low back because of this longer lever arm. So this is why it can be tweaky on the back. And again, in particular, people who have sustained a disc injury in the back can back up. So now let's show our variation. So this is if you're having problems with this exercise, the next is going to be what to do instead. And we're going to do front squats instead. So here is our alternative exercise. If back squats are bothering you because of that long lever arm affecting the low back, try this instead. So we're going to do front squats, and in particular here, we're going to turn the feet out just a little bit. Instead of having that narrow stance, we're going to be out just a little bit. And our objective is going to be basically to sink the hips almost straight down. So let's go ahead and give an example of that. So now notice here, I am about half the distance with that lever arm from here to here. Come back up. And also, as he goes down, I'll get out of the way so you can see. Do it again. He's sinking almost straight down, okay? And come back up. He's sinking almost straight down into the squat versus the hips going back as far. Again, the back squat isn't bad for you, but doing this variation is going to put a lot less pressure on your low back. Okay guys, our next exercise, and this is a really common one too, is a two-legged leg press. Now, I think it makes sense here for Adam to take us through a few steps of a proper lift. Again, we can go through maybe in another video how to do these lifts properly. Squats and deadlifts, they're fairly technical. They're basically an entire video by themselves. But Adam, if you can take us through a few steps for how to do a proper leg press in the first place, I think that would be helpful.
Very good. So, biggest thing you want to do when you're setting up is when you get your hips down low and tight, lower back, into this seam down here, make sure they don't move. You do not want them rotating up. So everybody's got a different range of motion. So when you're coming down, whatever your range of motion is, till your hips want to tilt, that's your range of motion. When it comes to pressure, you want a lot of pressure on your heels, and then if anything, you want just a little bit more on the outside of your foot to really engage these hips. You can even turn your feet just a little bit too to engage the hips a little more. And make sure that you don't tilt. So, controlled, push. Don't lock out your knees either.
Good. Those are great tips, because the common faults that we see, and that Adam will have to correct people on all the time as well, is that people, when they bring this down, they'll bring the knees down excessively, basically until they hit their chest. But most people don't have enough flexibility in their hips, so they end up curling over like a ball. And then when they go to push, they're having to extend themselves like this. Again, from an obvious standpoint, that's probably producing a lot of pressure on that low back, as well as other parts of your body too. So here's our variation. So let's maybe do a couple more reps here, just showing our standard form.
Okay.
Even with good form, again, this can still kind of put pressure on the back, and do a few reps for us here. Now, one thing is, he can tell you this as well, in terms of when he pushes where he feels pressure back against the seat, it's going to be on the back. So even with perfect form like Adam is displaying, we still have pressure going right through the low back. So now let's go ahead and go into a couple different variations of what we can do instead. So the first one, we can do a single leg leg press. So let's go ahead and change position here. Here we go. So you'll notice here, just straight in front of the body. Okay, let's go ahead and maybe demonstrate a couple reps here. But the same principles apply that he just talked about. So he's not going back as far as he possibly can. His hips aren't moving. And now, where do you feel the pressure pushing back into?
Just right into my hip.
Into the hip, that's right. So now the pressure is traveling back, and it's pushing on the hip versus pushing through the low back like it did with the two-legged version. It takes a little longer, but it's totally worth the extra time, so it's not going to tweak your back, and you still can develop those quads. Now let's go over one additional variation too. So this is a staggered stance leg press here. So we have one leg up here a little bit higher, the other one will be turned out here just a little bit. You'll have to twist the hips just a little bit. Now this may seem a little bit odd, but when you do it, you can actually feel how it kind of opens the legs up just a little bit, and when you press, there's a different force. Let's go ahead and do a few reps here. It'll put a different force on each side. Now the advantage here is this. If you do two-legged leg presses, from a bodybuilding standpoint, the different angles can help develop different parts of the quad. Well, here I can get those different parts. I have a straighter version, and I can change that other leg to go out as far as I want to. But the bigger reason, the reason we're talking about it here, is that as we push, again, where do you feel that pressure, Adam?
In the hip.
In the hip. So it's going to be this side hip that we feel the pressure going through. It's not going to be the back anymore. So I can do a two-legged version if I'm a little crunched for time or I want a little bit more weight, but now I don't have that pressure going through the low back anymore. So the last lift we'll talk about today for an alternative, if your back's bothering you, involves deadlifts. Okay, so obviously notice the theme is lower body lifts here. There are other lifts too that can be troublesome for the low back, but these are some of the most common exercises I have to give people advice on alternatives for if their back's bothering them. So the deadlift. The standard deadlift has a little bit of a narrower stance with the legs, and we have that same motion with the hips, that hip hinge motion. So if Adam can demonstrate that for us. So first of all, from here is the weight, here's our hips. There's that lever arm again. We have a long distance in between where my back is and where the bar is. So let's go ahead and do a rep. So again, it's a great movement, it's a great exercise, but we are having to start with the back far away from where the contact point is on the weights. So let's go ahead and show our alternative, which is going to be the sumo deadlift. So here, we have a much wider stance, the feet are turned out. Now look, before he goes up, here's my weight, here's my back. It's a much shorter distance, again about half the distance from where my back is to where the weight is. And go up. The weight goes straight up, and again, see how there, even though there is a hip hinge motion, it's more of a sink down versus that rock back with the butt sticking far out. Let's do 1 or 2 more reps if you don't mind. So again, going mostly straight down. There is a backward component to protect your knees. Again, as always with lower extremity lifts, we don't want those knees popping forward ahead of the feet. 1 more. Good, always power with the legs there. Very good. All right, so thank you for watching our video today. We really hope this was helpful for you. If you want anything more like this or different topics, please let us know. We're happy to do these for you. And earlier I said that I would give you suggestions for, okay, I'm hurt, I need professional help, where do I go? So first of all, identifying that you need help is important. I feel like for fitness athletes in particular, they have conditioned and you've conditioned yourselves to the point of really knowing how to ignore pain more than most other athletes. What I mean is that if Adam's doing a set of 15, the pump comes on hopefully maybe around halfway through, right? So maybe about rep 7, 8. The pump is another word for pain, right? So when you're feeling fullness, a stretching and burning sensation, that is the pump. And then you don't stop because it hurt, you stop because you went to failure. So you're constantly training yourself, even though I hurt, I continue to move. And so what I find is that oftentimes fitness athletes in particular, meaning the bodybuilders and the various other iterations of on-stage performers that are in the fitness community, and even personal trainers to some degree too, they just get used to dealing with things that other people, they just absolutely could not because they're so good at ignoring pain. But you have to come to grips with the fact that if something isn't going away, or you're having to change how you lift or how you work out because of the pain, you need to seek help, okay? So my recommendation is for you, if you say, I live somewhere other than Kansas City, I need help, is to go to activerelease.com. So it's active, A-C-T-I-V-E, release, R-E-L-E-A-S-E, activerelease.com. On the top bar, you'll find provider search. Put your zip code in, you're going to find people around you. Okay, the reason I mentioned that active release is a specific technique. We've used it with various people, including Adam here, with great success. Again, the reason I mention it is because the technique works, but generally speaking, if you go to a provider who's actively certified, that person has gone through a lot of expense and time and is really invested in honing their skills. So even if you don't need active release, if you need another treatment, you're generally going to have a provider or a doctor who's going to be really good and experienced. And then if you live in Kansas City area, or if you just want to contact my office for more information, we're at kchealthandsport.com. Again, that's kchealthandsport.com. And the name of our practice is Advanced Healthcare and Sports Injury. We have transitioned recently from Advanced Chiropractic and Rehab to Advanced Healthcare and Sports Injury. But again, I'm Dr. Kirk Iodice, and I'm here to help you with whatever questions you may have.
Thanks, Kurt. I really appreciate it. For us at Custom Fitness Consulting, I send a lot of people to Kurt that have very good experience. He's very knowledgeable, and he's helped me in multiple areas, or I wouldn't be able to continue to do what I do. So thank you for showing up.
Thank you, guys. Thanks, guys.